Alphonso Davies of Canada suffered a leg injury recently against the U.S. men's national team. It looks like as of right now, sources have officially come out and said that he has in fact torn his ACL and he's due to miss the remainder of the season. Sources have also come out and said that it is going to require surgery, which is very typical for a full ACL rupture. And the surgery type that's usually done in this type of case is something known as a full ACL reconstruction. With today's video, we're going to start off by looking at the injury replay so that we can look at Davies' mechanism of injury. After that, we'll go over the relevant pertinent anatomy and talk about why I believe the ACL actually tore in this particular case. And finally, after that, we'll talk about the grades of ACL injuries and the types of surgeries and rehab that a person will have to do after suffering this. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they're a little bit easier to understand. I'll also go over the pertinent anatomy of that particular injury and talk about the entire rehab process. If you enjoy this sort of content and you would like to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered an ACL tear, go ahead and comment on your experience in the comment section below. So we see here on the injury replay that as Davies is running down the field, the defender is unfortunately going to make contact with the back of his right leg, and this is going to send him down in obvious pain and where he's going to be grabbing that right knee. So here I have a model of the knee joint, and so the knee joint is formed by this femur bone, also called the thigh bone, that's going to come down and form the top portion in through here. Then on the bottom here, we have another long bone known as the tibia or the shin bone that's going to come up and form the bottom portion. And there are four major ligaments that contribute to overall stability in the knee. The first one and most relevant one for this video today is the anterior cruciate ligament, or the ACL for short, located right in through here. As we flip the model medially or towards the inside, we have the MCL, also called the medial collateral ligament. As we flip the model laterally or towards the outside, we have the LCL or the lateral collateral ligament. And finally, on the back here, we have the PCL, also called the posterior cruciate ligament. There are also two important pieces of fibrocartilage which are located on the inside portion of the joint here. They are the medial and lateral meniscus. You can essentially think of these as shock absorbers between the femur and tibia bones. Let's go ahead and talk about the function of the ACL in the knee. So the ACL has a couple different functions. The first one is something known as preventing any sort of anterior translation or frontward slipping of the shin away from the femur. And you can see that as I do that on the model here, that is greatly stressing that ACL located on the inside here. Typically, a person is going to injure the ACL when there is any sort of a force going from posterior to the anterior or from back to the front. And we see as we look on the injury video here that as Davies is running, the defender is actually going to make contact with the back portion of the knee here. And it looks like that force is going to be doing just this. It's going to be providing a posterior to anterior force that is located on the tibia, and that is greatly going to be stressing the ACL. The ACL is also going to provide a rotational stability at the knee joint, and anytime we see somebody that is going to be planting and cutting, and we see that knee essentially dive inwards or buckle in a very dangerous position, this is known as a dynamic knee valgus. It's extremely risky for the ACL. And once again, as we look at the injury replay, we obviously see that impact going from back to front, but it also looks like the impact is coming a little bit lateral to medial, which is essentially going to lead to that knee caving in as well. It's also important to say that because the force is going from posterior lateral to anterior medial in more of a diagonal, Davies was also at risk for something known as a terrible triad injury. This is where not only the ACL is going to be implicated, but you're also going to suffer a medial meniscus tear and an MCL. As of this moment, I have not heard any specific information as to whether or not other structures have been involved, but it's just important to know that in any time you see this particular type of a mechanism, other structures in the knee can be involved. Anytime we have a person that has a suspected ACL tear, we're going to perform a special test known as a Lockman's test. And so to do this Lockman's test, what we're going to do, we're going to have the person lying down, we're going to have the knee slightly bent, we're going to stabilize the person person's femur, and we're also going to pull that person's tibia toward us. What we're going to do is we're going to compare this to the non-injured side, and if the injured side we feel more laxity and or it's reproducing the person's pain, then this makes us believe that the person has suffered an ACL tear. There's another test that can be performed. It's very similar to this, but it's called an anterior drawer test. Basically, the person is going to be lying down, the knee is going to be flexed to about 90 degrees if the person is able to flex to 90 degrees, and we're going to be doing the same exact motion. So there are a couple special tests that we can do that can confirm a suspicion, but of course the gold standard is going to be the MRI, and this is where we're going to be talking about the grading system of ligament injuries. So in a grade 1 ligament injury, you're getting stretching of the affected ligament with maybe some micro tearing. In a grade 2, this is considered a partial tear. And finally, in a grade 3, this is absolutely the worst case scenario where a person is going to suffer a full rupture of the affected ligament. Typically, whenever a person is going to suffer a full rupture of the ACL, they're going to require that surgical consult because in order to get back to athletics, you need an intact ACL for knee stability. So basically, what's going to happen moving forward is the person is going to meet with a surgeon and they're going to talk about what type of graft to use to reconstruct that ACL. When it comes to the type of grafts that can be used for an ACL reconstruction, there are a few options. There are a hamstring graft from the person, a patellar tendon graft from the person, as well as something known as an allograft, which is from a cadaver. After an ACL reconstruction, a person is going to be in a big long knee brace known as a drop lock brace, and this is essentially due to the need to protect the graft because it's very sensitive right out of surgery. The person may have weight-bearing precautions and or range of motion restrictions depending on the severity of the knee injury and if other structures have been involved. Once the person is out of the initial protective phase of the ACL reconstruction, they can slowly start to work on range of motion and strengthening, and finally, when appropriate, starting to work on sport-specific movements. However, unfortunately, an ACL reconstruction does require a very extensive rehab process, usually spanning anywhere from about 6 to 12 months. So the fact that sources are saying that he's due to miss the remainder of the year as well as miss several months, I unfortunately have to agree with this. This is pretty standard for this type of an injury and the surgery that follows it. If I happen to hear any further details regarding Davies' injury, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So we wish Alphonso Davies the best of luck moving forward with the surgical process and the extensive rehab. Unfortunately, once again, it's going to sideline him for a significant amount of time, but with proper rehab, athletes are returning back to full function with little to no limitation. Thank you so much again for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the videos that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.